welcome to another beautiful episode of Healthy Living, reaching you from nation's capital, Abuja. I am Olamide Alhassan. Now, polycystic ovarian syndrome is a common endocrine disorder affecting women of reproductive age. Beyond its well-known implications for menstrual irregularity and androgen excess, PCOS significantly influences reproductive health, often posing challenges for women aspiring to conceive. Today's discussion will explore the nuanced interplay between PCOS and fertility, encompassing hormonal imbalances, ovulatory dysfunction, insulin resistance, and various treatment strategies. We'll also look at the importance of a collaborative approach incorporating lifestyle modifications, medications, and assisted reproductive technologies, while addressing the emotional and psychological aspect of fertility challenges. To walk us through this part today is reproductive health expert, Dr. Gilbert Nnaji. He's the author and founder of FertilityCode Naturals. Welcome to the studio once again, Dr. Gilbert Nnaji. We really appreciate your presence today.
Thank you for having me. I'm happy to be here.
All right. Because we're discussing PCOS, could you please give us an overview of what PCOS is, first of all?
Okay, PCOS stands for Polycystic Ovary Syndrome. It's a condition of the ovaries, a hormonal imbalance condition, in which a particular hormone called androgen is elevated abnormally. Okay, and then the insulin of the woman too is also abnormally elevated. Okay, so that explains the general features of PCOS. And then when you go further to do proper investigation, okay, scan, pelvic scan, what we know as ultrasonography, is also done for such women to be able to, to buttress this PCOS finding, because for women that have PCOS, via a pelvic scan, a multiple cystic nature will be discovered on the scan result. The ovary of the woman will have multiple cysts. That's where the name came from, polycyst. Poly means multiple cysts. Abnormal multiple cysts will be seen on the report of the pelvic scan. So women with that kind of condition is known to have androgen hormonal imbalance condition. Some of them could have features of being overweight or even obesity. Other ones could have acne on their faces. Even another male-related condition known as hirsutism, where hairs are distributed abnormally on the faces of this woman, even on the chest and some other areas. So it's not a normal condition. So when a woman is seen to have that kind of issue, she'll have difficulty getting pregnant naturally, because of the abnormal level of the androgen hormone. The androgen is a male dominant hormone. Yes, it's a male dominant hormone. So that's the hormone that makes men to have the features that the woman is then having, like having hairs on the body. It's not normal, because the way men are created, or the way men are created, this hormone is responsible for that man to have the kind of voice that I have, a Hoarse voice, hair distributions. It helps in the development of the genitals. It helps even in the production of sperm cells. It's a male dominant hormone. It helps men to develop right from infant to adulthood. So when a woman is seen to possess that hormone in that abnormal quantity or level, it will begin to present with abnormal features. If the woman would dysfunction in the area of reproductive health. So that is why women with that abnormal level of hormones have difficulties getting pregnant, because when it's elevated, it interferes with conception by making ovulation to be impossible. It actually suppresses ovulation. Yes, because biologically that hormone, what it does, because the ovaries of women make androgen. Why? Because it helps to mature the ovarian follicle. That is the function.
So it was supposed to be present normally.
In a mild quantity. But when it's abnormally elevated, it disrupts that system. Instead of enabling the woman for her follicles to mature, it begins to mature a lot of follicles abnormally because it's elevated. in quantity.
Okay.
Okay, that is what PCOS is basically about.
Okay, now there are questions as to how come it's elevated. What makes it get elevated if it's supposed to be present in the first place? You know, when you started the explanation, I was thinking, why do women have this supposed androgen, you called it? So why is it elevated? What causes it to get elevated?
Okay, number one, medical science says one of them is it can be inherited. Like from the mother of the female patient that is presenting with that condition can be inherited from a parent. Okay, and then number two, it's also lifestyle related. Certain lifestyle factors can result to PCOS. Things like poor nutrition. Okay, yes, when someone eats poor diet, let's say processed meals. This woman has been eating processed meals for a long time.
Okay. You are guilty of that.
Yes, it contributes to, and those processed, what are used in making those processed meals? Unhealthy fats, for example. Okay, let's eat food like donuts, you know, fries, all those kind of foods, unhealthy or used in making those foods. Over time, when someone consumes them, they begin to cause changes in the system, such as inflammatory conditions, hormonal because PCOS is generally a condition of hormonal imbalance. That is what PCOS is all about. That explains PCOS because the androgen is high. That explains PCOS. So when that is seen, I think that's also the way to also address the same problem is by addressing the lifestyle issues, and then not exercising, like living sedentary lifestyles, could also contribute to PCOS because PCOS is not only the androgen hormone being elevated. There's also a place of the insulin hormone being elevated because the body then resists insulin. Insulin is like a vehicle that helps to carry glucose into the body, into the body's tissues and cells, because without energy cannot do work.
I was beginning to wonder the relationship between insulin and
there's a relationship.
PCOS. You know, we used to look at it from the angle of maybe diabetes, insulin.
Not just that. When the body has more of insulin, then it will also begin to cause the release or production of the same androgen hormone. So you see, so that is there the counter effect comes in. So a lot of women that have PCOS, a lot of them are also overweight. So when you're addressing the same PCOS, you also address the issue of, you know, insulin resistance by giving the person medication that will cause the body to be able to receive insulin into the body cells or tissues. Because how do you check? You check the blood sugar level. You want to know if the person has high blood sugar. Because high blood sugar means that insulin is not being used. Yeah, so you check for insulin. You also check for this hormone presence. And then ultimately you do a pelvic scan. That is where what gives the hallmark diagnosis. Pelvic scan looks at the woman's ovaries. Are they normal? Do they have polycystic ovaries? So when it has polycystic ovaries, it explains the condition of the PCOS. And then ultimately what it causes women is it lowers fertility. It also causes irregular menstrual cycles. Yeah, people with PCOS, they find it difficult to have irregular menstrual cycles. A lot of them. That is one particular symptom of PCOS.
Wow. All right. With these things you've mentioned, can you please open us up to some of the symptoms of PCOS?
Okay. One of the symptoms of PCOS, it's like I said, hirsutism. That is hair distributions all over the body. Maybe the chest, you know, the jaws areas, sometimes on the legs too, because it's not normal for a woman to have that kind of, that's a male dominant features. Because like I said, the androgen hormone is what enables men to have these features. It's a male dominant hormone. It's not that the female does not have androgen, but in small quantity.
Yeah.
Just like for women are known to have more estrogen. For women, estrogen. So estrogen is what helps a woman to develop all those curvy features. You know, it also enables women to even ovulate. Without estrogen, the female body cannot ovulate biologically. It was enables women to for their womb to implant an embryo. That is a female dominant hormone. So, and in the body of female, it is expected that women should have adequate levels of estrogen for her to function properly as a woman. For the man, it's androgen. Androgen is what makes them to have bulky muscles. Okay, it's what makes them to have the kind of voice that I have. It's what makes men to perform sexually.
Of course.
It's what makes men to be reproductive, for them to have adequate sperm count and motility or morphology. That is, but when a woman begins to have
so
possess
much
the
of it,
hormone,
yeah.
it's not normal. It interferes with their conception ability. So one of the symptoms is hirsutism. Number 2 is acne.
Okay.
Number 3 is polycystic ovaries, but then you can't see those with your optical eyes. It has to be done through a pelvic scan or ultrasonography. Okay, and then weight gain too. Weight gain. So these are hallmark symptoms. When you want, like as a doctor, if I'm in the clinic and I want to see a patient, okay, let's say someone is coming towards me, a woman, and then I could make what is called a spot diagnosis.
Oh, really?
Yes, by just looking at this woman's body, and then when I see hairs on her body, maybe on her jaw abnormally, I could tell this woman could have PCOS.
So what about the situation where some persons actually have male dominant genes and they tend to grow some of this hair? Is that not possible?
Male dominant genes.
Yes.
Well, that is very rare.
Oh, okay.
Okay, it's very, very rare.
Okay.
And that situation is very, very rare. Okay, so but then commonly, women with these features that I mentioned, like these 4 features in number, a lot of them, by up to 95%, they could have PCOS.
Is it possible to have PCOS and not know that you have PCOS?
Well, it depends. Okay, it's not a normal health condition. For women that have that particular problem, they should be bothered, because unless the person is not actually making effort to conceive,
Okay.
yeah, that is when they seek help. When the woman she's married, and then she's been trying for conception, let's say the past 5 years, she's not taking in. She should know that something should be wrong, because one of them is, I didn't remember to mention, is irregular menstrual cycles. It is normal for a woman to have regular menstrual cycles every month. So if her menstruation is skipping every month and it's not regular, that should be a matter for concern.
Okay, do you know the reason why I asked this question? Because I feel like some single persons do not even care to, check themselves this much. It's only, most women don't even check. They only wait until when they are trying to have children
yes.
and they can't have children. Some will even premise the irregular menstruation on the use of contraceptives. So that's why I'm asking some of these questions.
That is true. Okay, like I think I have a relative that has that same problem, and how did she get to reach out to me? It was when she started experiencing irregular menstrual cycle. That was when she became bothered that she doesn't see her period every month. That is, that is always skipping. Then I told her, okay, why not go do a scan? Let's see. And she came back with that report, PCOS. Okay, and then another point that you made is that this contraceptive that women use, the oral, called postinor, that's another thing that can also cause irregular menstrual cycle, because when the body overuses it for, let's say, more than a year or 2 years, they are synthetic hormones. So what it does to the female body is to increase in quantity. When it increases in quantity, it disrupts the hormonal pattern. But a lot of women don't know. They think maybe because of it, they can buy it over the counter, and then it's approved by the FDA that they can freely take it. But then it has certain side effects too. Okay.
Yes, absolutely.
So those are the features of PCOS I just mentioned.
All right. Let's also talk about how it now generally impacts the reproductive health of most women. How does it impact the reproductive health?
Okay, PCOS is one of the causes of infertility. One of the causes of infertility, very common cause. So women with PCOS, they find it difficult getting pregnant. Okay, that's just the bottom line. They find it difficult getting pregnant, which is one of the issues why women go attend outpatient gynecology clinics or fertility clinics. It is, and here in Africa, it's a common challenge. Like I have patients that I'm actually treating at the moment with PCOS. Okay, but it doesn't mean that women with those challenges, they cannot get pregnant.
Of course.
They can get pregnant. What they need to do is to approach the challenge, approach it holistically. It's not just about taking just medical drugs, taking ovulation and using drugs. You need to think of how to correct the underlying cause. Okay, it has an underlying cause. Okay. Like I said, poor nutrition. And when I mean nutrition, food.
This underlying cause can be assumed to be risk factors.
Well, yes, risk factors.
Okay.
Nutritional issues. What you're eating may not be healthy, and what you're drinking too. And what are you drinking? Soft drinks, fizzy drinks, and they have sugars.
Sugar-sweetened beverages.
So sugar causes another problem to the pancreas. That is why you see insulin is going up too.
This is like a revelation, because one would be wondering, what's the relationship between, taking my chill drink, sugar-sweetened beverage, alongside infertility? Nobody would ever want to associate these two. Like, how can I enjoy myself and it will be causing infertility? But I'm hearing that from you for the first time.
No, for real, but because that is what, science is dynamic. There are usually new findings, new research information out there. So we need to doctors that seek for information, at least they are the ones that help their patient more by giving them up-to-date information. Like I'm talking to you now, I also have I have passion for what is called integrative medicine.
Awareness,
and lifestyle modification. So I've done courses on lifestyle modification programs, and then it gave me deeper insight on how to help my patients with their nutrition. Because you need to think what we are eating is harming us. That's the truth. It's harming us. All those things that we eat to buy from grocery stores, they are not food.
We definitely need to have another segment talking about wellness and all of that. But now, there's another question that has been bothering me. Are there stages to PCOS? And if there are stages, at what stage does it lead to an ovulation?
Okay, if there are stages to PCOS, they're not actually stages to PCOS. It's just when a woman becomes diagnosed to have PCOS, even before she goes for medical examination, there ought to have been maybe a delay in trying to conceive if she's married already, or maybe as a single person, there ought to be delay in terms of menstruation. These are the two things that take women to the clinic. Okay, and then the anovulation is a medical term for lack of ovulation. So it is when she's making effort to conceive and is not forthcoming, because the androgen hormone, what it does is it doesn't really mature the ovaries like it's supposed to, because of the elevation of the androgen hormone. It doesn't mature the ovary properly. It rather creates a lot of ovarian follicles that are immature. So such follicles, they can't ovulate. They're not mature enough to ovulate healthy eggs. You understand what I mean?
Absolutely.
So it is supposed to mature the ovaries, and then another hormone would then take over called the estrogen, which would then ripen the ovary properly, and then ovulation would happen. So the follicle it doesn't mature the follicles really well. It just mature them halfway, and then the woman begins to struggle to conceive because of what? The immature, the lack of maturation of the follicle. That is what elevated androgen does to the female body. So that situation is actually called anovulation medically, because there's no ovulation.
Yes.
And when there's no ovulation, the body might not menstruate. There'll be lack of menstrual period.
Okay, but earlier you mentioned that presence of cyst is polycystic syndrome. So the question I want to ask again is, how do we understand cyst in the simplest of language? Okay,
cyst, it's the fluid-bearing sac. Just imagine what a sac is. A small sac bearing fluid. That is generally what a cyst is. A sac, a little sac bearing fluid inside. So that is what polycystic. Polycystic means there's a cyst that is bearing fluid inside. And in the terms of PCOS, those cysts are not properly mature.
Okay.
You understand what I mean by that? Is just how to explain it in the simplest
Does it have any relationship with fibroid?
No. Fibroid is practically a tumor.
Okay.
It's a tumor, although not a cancerous tumor. It's a tumor, and that fibroid is being fed by estrogen hormone. It is estrogen hormone dominant. That's fibroid. It's not like the other one, the PCOS is. No. What causes fibroid is when there's an elevation in the hormone called estrogen of a woman. Sometimes science says it also could be inherited. That's fibroid. Yeah, it's could be inherited. And people that present with that condition, mostly African women. And down Caucasians.
Okay.
Yes.
Now, for this PCOS, now, are there age range that could be exposed or could be prone to PCOS? Are there age range, or anybody from reproductive age?
No,
works?
there's an age range, anything from 20 and above.
Okay.
20 and above. For someone that's not actually.
Wow, someone that's young can actually have PCOS.
Yes, of course, from 20 and above. As long as this woman has begun to menstruate, she is liable to have PCOS.
Okay. So how long can one have PCOS before irregular menstruation begins to occur?
How long
could you already have PCOS before you start?
menses?
Yes, those symptoms start, showing up.
Once the symptoms of PCOS becomes manifest in the body of a woman, that is the duration.
Oh, okay. So there's no, there are cases where sometimes you already have this health condition and it never gets to present itself in any way until you begin to experience some extreme part of it before you begin to experience the symptoms.
Those symptoms I mentioned,
yes.
Those are hallmark symptoms. The irregular menstrual cycle, that's number 1. 2, the hirsutism. Number 2. 3, if the person has done a lab and then revealed the person has high blood sugar level. That's number 3. And then ultimately pelvic scan. And the pelvic scan is the last one because a lot of women, they don't do scan until when they've tried to conceive and it's not coming
or something. Yes.
Okay, but then the number 1 there is irregular menstrual cycles. At least you should worry a woman. She should ask herself, why am I not seeing my period?
Singles don't ever get worried when they don't see their period. They'll be like,
please
let me rest from the painful.
Okay. Wow.
Painful experience.
That's interesting.
No, I'm just saying, those are the words that some people say on the street, because sometimes I get to ask people. The first time I heard of PCOS, I decided to, ask people questions. I asked, have you ever heard of PCOS? I was like, which one is PCOS? I was like, okay, do you get to experience regular menstruation? Like, it comes now, and if it does not come, thank God at least I'll not feel pain. I'm like, really? So long as I'm not pregnant, I'm not worried. So, there are those parts of it, and it calls to question as to how well do we take care of ourselves, our health, and how well do we watch and, pay so much observation to our own, health and how healthy we are. So most times I know most women don't even care until when it has become detrimental. I'm trying to have a baby and baby's not coming. So we start checking what is happening to me and what is wrong with me. That's why I had to ask that question. All right, now let's talk about the state of mind of the patients that you try to attend to who have PCOS. How do you even get to manage their mental well-being alongside PCOS?
Someone said, where the body goes, the mind follows. Okay, right? Or where the mind goes, the body follows. Where the mind goes, the body follows. Okay, and now the thing is, our mind is very important to health. Something in the medicine called psychosomatic condition. Psychosomatism means that someone is ill, and then the person keeps taking pill. The person keeps taking medication, and the medication is not solving the problem. The mind could be a tool to heal that person. Let's say, for instance, now, let me use another example that you could relate. For instance, someone has diarrhea. You do know that diarrhea, that might not be due to maybe infection or microorganism. It could be due to emotions, how the person feels. It's called emotional diarrhea. Have you heard about emotional diarrhea?
No, like that's
Let me give you another example, practical example. Way back in school, I don't know if you've had that experience. I think one or two persons have had that. Even I've had it in the past. Let's say suddenly you didn't read for an exam, and so you now have something like exam is tomorrow. If you're not careful, you might even rush to the bathroom.
Okay. I think I've heard that before. That when some people have anxiety,
and they feel like they want to go and poo suddenly. That's emotional diarrhea. That's because of it's the mind. It's the mind. You understand, Ba?
Absolutely.
So the mind is part of the healing process. You understand? So when it comes to PCOS, the mind also has to be employed. Especially if this person is trying to conceive. It's called mind-body science. Okay, mind-body science. If the person trying to conceive, you need to first of all believe that you can be healed, that you can get better. You see? So when you start thinking that way, what they call neurochemicals, things like serotonin, endorphin, things are our endogenous healers in the body that helps the body to heal by releasing all those feel-good hormones, feel good neurochemicals that helps the body to heal in the area of pain. It helps to address pain issues. That state of mind, it helps, it makes the body receptive to treatment. That is just the conclusion. It's about being positive about your condition too. You have to be positive.
I like that part where you said one has to be positive. If you want to get treatment, you have to be positive.
Yes.
Let's go on a quick break, and when we return, we'll be talking more about the treatment options.
All right.
All right, viewers, I hope you're enjoying the conversation. Let's go on a quick break. When we return, we'll continue the conversation. Stay with us. Welcome back. You're still watching Healthy Living, reaching you from nation's capital, Abuja, and we're still discussing with Dr. Gilbert Nnaji, and now we're moving to treatment of PCOS. All right, Dr. Gilbert, earlier you were talking about some of these anovulation here and there, and there are already a lot for us to understand, and it's really overwhelming. Now, let's talk about how this PCOS can actually, the irregular menstrual cycle, how it can actually impact ovulation, especially when someone is considering family planning and conception at the same time.
Okay, how PCOS impacts ovulation?
Yes.
PCOS is, like I said, is a condition of a hormonal disorder, especially the androgen, okay, which presents with features of weight gain, okay, infertility,
yes,
irregular menstrual cycles. So women with those challenges, those are the issues that actually prevent conception. When I mentioned lack of menstruation,
irregular menstrual,
and then anovulation, that is inability to ovulate because of the interference of the elevated androgen in the body of this woman. It hinders the natural conception mechanism. So in that way, it actually reduces the woman's chances of getting pregnant. So what that woman needs to do is to see a fertility doctor or a gynecologist, okay, and then get to be assessed, because you don't know. It's not enough for you to embark on self-medication spree and start buying all sort of online supplements online and all those things women they purchase from online social media platforms. You see a medical doctor, let him get your history, assess you, send you for some relevant and important laboratory tests, so that he could make a diagnosis. So when a diagnosis is made, then the treatment could then be prescribed for you. That way you get results in what you're seeking for. Okay,
so we're looking at it from the angle of the timing for ovulation when it comes to conception, and then someone who wants to do family planning.
The timing for ovulation?
Yes.
I don't understand that.
Okay, now I'm asking, how will this irregular menstrual cycle impact ovulation? And when you're thinking of conception and planning to have, doing this regular family planning that hospitals tend to ask you to do?
When you say family planning is someone that is fertile, that is not battling with infertility.
Okay.
That's family planning.
Okay.
But this PCOS is already a challenge for a woman that's trying to conceive.
So it means that she has no reason to want to consider
family planning. No business.
Okay.
Because what's the goal of going for family planning? Is that you've had enough children and you no longer want to have children. But in PCOS, you're not even having one child. It hinders you from conceiving.
We used to think that when there are options for treatment, it simply means that we can talk about conception and we can talk about family planning.
Okay, let me come. When you talk about treatment, the treatment options for PCOS, okay, now it's broken into two types. First type is medical treatment for women with PCOS, medical treatment, and it includes taking drugs that will help the body to be receptive to insulin. There's already insulin resistance in that kind of person. So drugs that will help the body to be receptive to insulin hormone. Okay, that is because when there's so much of insulin in the body of a woman with PCOS, it indirectly causes more androgen hormone to be produced in the body of this woman. through the ovaries. So there's another, you see the chain reaction. So you want to address that condition. That's number one, medical treatment. I don't want to mention the drugs here.
Yeah, of course.
Then number two, you also want to address the problem of irregular menstrual cycle. You want to address it. So anybody's woman to be seeing her period, because if a woman is not seeing her period, she won't conceive.
Okay.
She has to see her period to conceive. And then thirdly, you can then prescribe this woman ovulation inducing medication to enable this woman to ovulate. Because ovulation is just releasing an egg that the sperm will possibly fertilize and in conception. So if she's not ovulating, you can't talk about pregnancy or conception.
Absolutely.
So these are the three things that could be addressed medically, and there are drugs for that. That's for medical treatment. And then two, natural treatment.
Okay.
Natural treatment.
Okay.
Natural treatment is in terms of the area of lifestyle modification. You want to prescribe exercise. It's a pillow. You know, it's just a medication, exercise. You don't know because you don't buy it in the market.
Because we don't, people don't exercise until when it becomes really detrimental to their health.
For a woman that is overweight, you need to exercise now. You need to burn off those calories. It's a therapy. Exercise is a therapy. People should start seeing it like that. Because it's not free, because you don't purchase, it means that it's not important. It's important. So exercise is one of the treatments when it comes to the natural treatment perspective. Then number two, you need to begin to address your diet.
Okay.
You need to stay away from processed food, canned food. Those are things that can introduce all those unhealthy substances into your body, like unhealthy fat, sugar, and all that.
Yes.
That could harm your pancreas. That could also cause hormonal imbalance, like the high androgen. You need to look at your food. You need to embark on a healthy eating pattern. Take more veggies.
Okay.
Take balanced diet. Avoid sugars. And then number three, hormonal therapy. So there are some drugs that can actually fix hormonal issues, like when there's so much of androgen, hormonal balancing drug, and they're available. You can take hormonal drugs. Okay, available. Some of them are in the market, and they have NAFDAC approval, and they're all natural. Okay, yes, they're all natural. We prescribe it in the clinic. Okay, so I have NAFDAC approval. So these are how to. And then, if possibly you have the person has access to a health coach, let's say a health coach in the area of healthy dieting, why not take advantage of that? They work. I have patients that have come out of PCOS and they've conceived.
Okay.
Yes.
So that means there's hope.
There's hope. There's hope. It's no longer those times people just stay in the dark. They don't have hope. They just look hopeless, and they start doing all sort of funny treatment to get pregnant. Now these things they are what people are taking advantage of now to conceive, and they are healthy. They are healthy. So why not?
Okay, because I had to ask if there's hope, because there's a lady I know that I didn't even know she had PCOS.
Okay.
For goodness sake, she's so tiny, like you would barely be able to tell that. Because I'm looking at some of the symptoms you've mentioned, and I'm picturing her, I'm thinking about her as you're mentioning some of those symptoms. She's not hairy, she's slim, and I don't know, I didn't know about her menstrual cycle. So when she got married, we were talking, I was like, when's our baby coming? The usual thing with ladies always trying to hide their pregnancy. So I thought that was what she was in. And she was like, oh, I don't see my period. I was like, why? She was like, I have PCOS. I said, you do? I was like, is it possible that there are people who don't present with other symptoms? It's just like one that they will have, and that's all?
Yes, that's all. And I'll tell you why. Now, it's not every woman that has PCOS will present with obesity or overweight. Okay? Some of them could just have normal weight. And like I said, if you approach it from the area of poor nutrition, it will make sense to you to know that sometimes food could be responsible for PCOS. Maybe the person is not actually eating, it's actually eating right. But then you will now look at the area of hormonal imbalance, meaning that the possible cause of the PCOS could be due to hormonal imbalance issue. What the person could probably done or consumed that created the imbalance in the area of the androgen hormone being elevated abnormally.
Okay.
So not every woman with PCOS presents with overweight or obesity.
Okay.
Not all of them.
There are also situations where pardon me if I'm bringing in these questions, because there are questions that people tend to ask, and I keep them. I say when I meet a doctor that is best suited, I'm going to be asking those questions. So there are questions of What about a woman who's lactating when she's not even breastfeeding any child?
Okay, that one is another typical concern that a lot of people have. Now, a woman that is not lactating and she's expressing breast milk, right?
Yes.
That can also cause infertility. It's actually called hormonal imbalance, and the hormone is prolactin hormone.
Okay.
You know, there's a lot of hormones in the female body, even in the man's body.
Oh.
The estrogen hormone, the progesterone hormone, the prolactin, these are key hormones.
Okay, but the one in our focus is androgen hormones.
The one we are talking about now,
yes.
it's androgen hormone. The prolactin is a hormone that a lot of women, their body produces the hormone when she's pregnant in her late trimester, or when she's lactating. That is what enables her to breastfeed. You know, the hormone helps for milk production. But when a woman is neither pregnant, neither lactating, and she's still producing breast milk abnormally, it's not normal. It's typically a hormonal imbalance problem due to what they call hyperprolactinemia. That is elevated prolactin in the body. So a lot of young individuals, a lot of women that are singles, they have that condition, and it's common.
Wow.
It's common, and it's treatable too. It's treatable.
Even though some of them just wait and let it just go on its own.
And it doesn't happen that way. It needs to be treated.
Okay.
So that doesn't, if you delay, you may start affecting other systems in the body. So it has to be attended to.
Okay. Let's talk about. You earlier mentioned the pelvic scan. So how does this impact these women's treatment, especially when it comes to other diagnostic tools when you're observing them?
Okay, pelvic scan is one of the medical miracles in the diagnostic industry. Because it has actually helped to solve a lot of problems for doctors. Because without that technology, it would be difficult challenging for the diagnosis of PCOS to be made. Because PCOS should be a diagnosis that is physical, that the body is able to appreciate the changes. Because through a scan, you'll be able to see those abnormal cysts in the body of the woman through the scan. So the scan is very useful to make that diagnosis. It helps to get a picture of how the ovaries are performing. Because if a woman is ovulating now, or let's say she's about to ovulate, and you conduct a pelvic scan on this woman, you'll be able to isolate one particular follicle that will be bigger than the rest of them. That shows you that this woman is about to ovulate. There'll be one, they call it dominant follicle. There'll be one follicle that will be bigger than the other follicles. So when you're able to isolate that follicle, you could tell that this woman would be likely ovulate maybe in a day or two time.
Okay.
So when you conduct the same scan on another person, and you see a lot of follicles almost the same size, then you can tell the person has PCOS. It just educates you on that abnormality, and it gives you that clarity that okay, this is what we have on our table. And then you then know the next action to take, which is the treatment, whether you're going medical or you're going natural. It gives you that clarity.
All right. In your experience as a medical doctor, are there assisted means for a woman to, take in for maybe someone that has PCOS, maybe something like IVF? Are those options open for women that have PCOS?
Yes, and I thank God for IVF is actually what has come to give women hope. It has given women hope all over the world. With IVF, a lot of people have been able to have their families. So women with PCOS, they can also explore the option of, I didn't mention that, I didn't actually remember to mention, they can also explore the option of IVF. It shortcuts all those other measures, shortcuts the natural measure, the medical measures. You then go straight forward to receive injection that would cause the woman to ovulate, because there are injections via IVF that women receive that will ripen the follicles normally to produce eggs or an egg through IVF. And it's not like androgen. Androgen just go on auto reaction, and then the woman starts having multiple. But with IVF, in controlled doses of injections are given to a woman, and then she ovulates. The eggs are collected. It's called oocytes. The eggs are collected, and then the partner is invited to the clinic, and then his sperm is also collected, and then it's fertilized outside the body, and then cultured, becomes an embryo, and the embryo develops for about 4 or 5 years, and 4 or 5 days rather, and then it's transferred back into the womb of the woman. So it works. IVF works for women that want to explore that option But not everyone that has the money now.
The way you just described it made it sound so simple.
Of course, it is. But I've been through that too. So
Okay.
I've been through that training, so I know how it works too.
Okay, now this explanation you just gave now for IVF and a woman who has PCOS, I'm trying to picture something. How long does it take for PCOS treatment? You know, you said anywhere the mind goes, the body
follows.
goes. Yes. So how long does it take for a woman to get treated when she has PCOS if her mind is really there? How long, from your experience? What's the most space of time that anyone has ever had to go through when it comes to treatment?
It depends on the patient.
Oh,
It depends on the. She has to be ready.
okay. That's why I said when the mind is there.
Yes, she has to be ready. Because if she's not ready, okay, let me use another case study to buttress this point. Now we had a patient, you know, that she had cancer. So one of the physicians attending to her was more like a consultant physician, and then he's also someone that is a good counselor. He's trained in the area of mind science. So he began with her. He began giving her talk therapy, or called psychotherapy, professionally. He began to use psychotherapy to talk to her, and then educate that soon enough she should be going for chemotherapy, other therapies that will help her to heal from the cancer. But first of all, she has to have faith in the healing process. And I was presenting that particular conversation. I even ended up becoming the patient because I felt the impact of the words that he used. It was very therapeutic. It was supposed to unloosen the knot, because you know what that diagnosis does to women. Now you have cancer, they start thinking of death. You know, those things are negative. You know, they create barricades for healing. So he began to talk to her, even gave her a book, and I was amazed, like, wow, this is awesome. So, and then unfortunately, the woman, she was more like really negative. Yeah, she needed instant solution. She wanted, and it doesn't happen.
It doesn't.
It doesn't.
It never does.
And eventually, she died, unfortunately, because it was almost an end-stage cancer. But if she had listened to this expert, if she had listened, it would have helped her. It would have probably prolonged her life. So people should know that health starts from the mind. That is why people go to church and pray. It's the same faith now.
Absolutely.
It's the same faith. People go to church to pray so that you have patience for the change to come. Okay, so that you have expectations. That is the same thing that happens when it comes to mind-body science. You need to believe that you can get better. Something also called placebo. Placebo is when someone, okay, in the medical setting, someone with, let's say, pain, let's say headache or pain in any part of the body, and then the person is taken to a hospital. Maybe the person does not, maybe there's no painkiller injection. The person might be given water. Let's say the person came to the clinic and there was no medication, but he wants injection. Just give me injection. The person could be given water, inject the water, and then because of that feeling that, okay, he has been injected, that pain will subside. It works. Because the mind has told him that if you're giving that pain medication, this is what science needs to go deep and study more. It's amazing that how this happens, because the human body has something in the mind that actually heals. You had pain, and someone gave you injection, then the pain stopped. Is that not very interesting, right? Very,
because I'm surprised.
Yes,
but you're right. Healing starts from the mind.
From the mind, yes.
Honestly, I don't. It's quite overwhelming to learn some of these things, because most times people just feel like until this happens, this cannot happen. So that's why I had to ask you about the duration of time, because I'm sure somebody's watching at home and they're wondering, how long can it take to heal? How long can this process take? So now that we understand that it has to do with the individuals, but on the average, from your experience, how long has it taken some of your patients to actually heal?
Okay, to actually get better. Well, it varies. It varies. It depends on the underlying condition. Like, let's say, for instance, somebody may have mild malaria, and the person may have severe malaria. So it's not the same treatment duration that both of them would require to get to heal.
Sure.
So it depends on the stage of the disease or the abnormality. That is when we also have that prognosis for the healing.
Okay.
It depends on the stage of the condition, whether it's mild. Some people they've had that problem for 5 years, so you don't expect to be healed
the same as
instantly.
someone earlier.
So you have to be patient.
True.
That is why when you start treatment, you go for checkup, you go for follow up, so that the progress will be monitored. Eventually, you'll be fine.
All right. So what happens to those who have conceived? Are there other after treatments during their pregnancy, and does it in any way eventually affect maternal or fetal health?
Well, it doesn't. Clearly on record, it doesn't affect the baby or the mother. It doesn't. Once someone is free from PCOS and you've taken in, it means that the body has come back to the normal state.
Okay, so no further follow-up treatments, and there are no cases of having PCOS at a later time?
It's only when you go back to the old habits. Those things that you're asked to quit, let's say the poor diet, and you went back. It has happened. I have a patient too that, after she became free from PCOS, and then she went back to her old lifestyle. She stopped exercising. She began to eat all those wrong, and it came back.
Wow.
Yet it came back. It tells you that these are the root causes of PCOS. These are the risk factors too. So once you are fine, you are better, you are expected to stick to the new lifestyle. That's why it's called lifestyle modification. It's an important part of integrative medicine.
Okay.
So, once you find out that, okay, this thing that you did was what actually caused this PCOS, and then you were treated and given the right treatment, and you became better, you shouldn't go back to that old lifestyle. Otherwise, it will come back.
Okay.
That's why the Holy Book says, "Go and sin no more."
Indeed, though. Indeed, we need to, somebody is hearing, go and sin no more. Please, in case you are going through this stage, go and sin no more. Just be very careful. All right. Is it possible that you tend to give your patients some sort of education and awareness when they come to the hospital, so they get to understand that, oh, this is real, this can happen, and these are some of the reasons why we go through some of the things that we go through? Does that happen?
Very, very. This is actually the foundation for this treatment, PCOS. It's called, we have a program going on now. I started taking clients in December. It's called Fertility Coaching Program.
Okay.
And it's typically for women with PCOS.
Oh, okay.
And overweight people that have that overweight. It runs for 12.
Why should it just be PCOS? Because I know there are lots of other women that have fertility issues that are not PCOS.
Okay, this one is just particularly for PCOS.
Okay.
Because it's something that, you can't treat PCOS overnight. You need to start time of working on your body. You need to start working on your diet every day. Okay? There are things to stop doing. And then someone needs to take you by the hand while you're on that journey of treatment. That is why we had to, to stretch it to 12 weeks for 3 months.
Okay.
And people that have done it, they got results, and we've gotten testimony of people that did the program. It's not typically a condition where people just take only pills. You have to address the issue of weight gain. You can't fix weight gain with medication.
Okay.
You can't fix poor diet with medication. Someone that had bad diet of eating wrong, it's in the mind. You need to be patient. You need to work with the person. You need to coach and counsel so that the person can come out of that habit. It's called coaching. Helping the person step by step address all those issues, recommend the right thing, you follow the person up so that the person can come out of that condition. And so far it works. It's a fantastic system that's been working for us.
Wow. So where is that? When is that supposed to be, the coaching?
It's actually for now because of, some of our patients, because of their work, and, we just made it to be online. It's an online, and it's very effective. It's working. It's an online program. Okay. So it's working. We just recommend them things to take, give them shopping list, meal plan. They go to wherever they are, buy those things, they buy those foods, make the smoothies, make the juicing, and then it's fantastic. It works. And then if there are medications we recommend or we prescribe, and they start taking it from home, it's a home-based treatment.
Oh, that's good.
And we'll have a coach, we'll have an in-house health coach that takes them on, and it's working. It's very effective.
All right, so rounding up now, what advice do you have for patients living with PCOS and for women in general? Okay,
my advice is this. Health is wealth. Health is wealth. And then number 2, what you put into your mouth will either make you or it will kill you. Okay? It's very, very important.
Absolutely.
It's either it adds to your health or it harms you.
Absolutely.
Basically.
All right. Thank you very much,
Yeah,
Dr. Gilbert Nnaji. Really
You're
appreciate
welcome.
you for your time today. Thank you, sir.
You're welcome. Thanks for having me again.
Thank you. All right, viewers, we've been speaking with Dr. Gilbert Nnaji, a reproductive health expert. And like you heard from him, wherever the mind goes, the body follows. Your healing is in your mind. Write that somewhere so you can always see it. And don't also forget that health is wealth. Take care of yourself. I'll see you again next week. I am Olamide Alhassan. Bye for now.